All right, we are in the mix, mixing it up with Dr. Karan Wade. She is in the house. You know, she is the dentist of dentists, and she's here to talk with us here in the mix on 12:30 a.m. KCOH Houston. She is conveniently located in the heart of downtown Houston. We're right on the outskirts where parking and all of that is not a problem down near. That's St.
Down by St. Joseph's Hospital, right across the street from St. John's Church.
Two major foundations right next to you.
Exactly. We have a prime. We're in a prime location, so it's really accessible to almost anyone, whether you're driving or even if you have to take public transportation. There's a bus that stops right 2 blocks over on Main Street. We're 2 blocks over from Main Street, so there's really no excuse not to come see me.
Oh, really, really. And how often should one visit?
Well, one should visit their dentist at least twice a year because we tend to accumulate plaque and bacteria on our teeth. So you want to visit your dentist twice a year to identify any problems that may be coming about or things that may be existing that need to be taken care of. So twice a year is the most ideal time that you should see your dentist.
And does it matter every 6 months or?
It should be every 6 months. You don't want to come in too much more than that because we won't be able to take any x-rays any more often than that. But the thing is that if you're having a problem, you need to see me or any dentist if you haven't been to the dentist in the last 6 months. So you really need to come see your dentist every 6 months, and they can identify things that might be going on in your mouth or things that you don't even know that are going on in your mouth. So you want to see your dentist at least twice a year.
There are a lot of bad dentists out there. How do you tell a good one from a bad one?
Well, that's really an individual decision. I don't know if I would want to say bad dentists. There might just be dentists out there that don't do things that are quite ethical, or they might not do things that are quite up to par or what the American Dental Association
let me tell you something that happened
so tell
to
me the story.
Okay. I needed a root canal.
Okay.
And I had that root canal done. Mm-hmm. And after a while, I started getting like infections.
Okay.
Antibiotics became one of my closest friends. And I never could figure where the infection came from.
Okay.
Finally, somebody suggested that I have the root canal be redone.
Okay.
And someone that other dentist had put some metal in my tooth. You know how y'all stick stuff off?
The little files, yeah.
Okay. Mm-hmm. Well, it was corroding.
Okay.
Yeah, and
so the file broke inside the tooth when the initial dentist was doing the root canal.
Obviously.
Okay. Well, they should have told you that because that's a possibility that could happen when you're doing the root canal because you have these little files and you're going down into these little canals that are in your tooth. And if it was a posterior tooth, the tooth in the back, it has 3 canals, and those canals are real small. It's possible that the files can break, but you should notify the patient that the file has broken in their tooth, and so that it's either the tooth would have to be extracted or the patient would need to be sent to a specialist so that file can be removed. You don't just leave it there.
Well, guess what? They did not tell me. They left it there, and I had to go to a specialist. It cost me an arm and a leg.
Sure it did.
And years really of discomfort because I had no idea
what was going on. Right.
But it would cause me to
Did you lose the tooth?
No.
Oh, he was able to salvage the tooth?
He was able to salvage the tooth.
Well, the thing is, like I was saying, it is a possible side effect when you're getting a root canal that a file could possibly break in there. Okay, the doctor or dentist that's doing the root canal knows when that file is broken off, and they should have told you that because, we know how you sign consent forms. That's one of the things that possibly could happen. And when you sign that consent form, they should have said, a file could possibly break. When I'm doing root canals, I tell my patients that if a file breaks, I'll let you know. But that's very easily seen on the x-ray, so I'm not sure how they could have missed that. But
well, I
understand your classification of bad dentist.
Yeah, because that was years.
Yeah, yeah,
years.
and the file will break down. The thing is that when you're doing a root canal, apparently, if you have to have a root canal, the tooth has bacteria that's in it anyway. And if you don't clean out all of that bacteria, the patient is going to continue to have symptoms. And if they put a file down in and the file broke before they even cleaned the bacteria out, well, guess what? You're going to have a situation like yours. You're going to wind up having to go to a specialist. So I understand. I empathize with you. But like I said, I'm sure every dentist that has ever done a root canal, at some point in time, they have broken a file. I have broken files. But you have to notify the patient that the file is broke. Sometimes you can get them out very easily. Most of the time, thank God that I was able to get my files out. But if you can't get it out, you do have to send that patient to a specialist. And,
Yeah, it was time consuming.
Time consuming and very costly, I'm
And-
sure,
and-
especially if you went to a specialist.
Yes. And that's why I asked the question, how do you?
Well, it's really hard to determine. You can't just look at a person and say that person is a bad dentist or that person's a good dentist. I try not to judge people. You have to judge people based on their work. And so patients have to be, have to take an active part in asking a lot of questions if they're going to see a new dentist or even a medical doctor. Ask questions of the other patients. Try to see if this doctor or dentist has good or bad reviews. I mean, the internet is out there. I mean, you can get information on any and everybody nowadays. So it's just things like that. I mean, you can even check with, on the website of the Texas State Board of Dental Examiners or Medical Examiners, and they can let you know whether this doctor or dentist has had any major issues. I mean, that doesn't mean that they didn't. It might not have made it, to that point. But things like that. Sometimes you just have to do your own homework when you're going to see a dentist. But just saying, you can't really tell just by looking at a person saying they're a good dentist or they're a bad dentist. So it's kind of like you have to do your homework sometimes, and then sometimes it's just based on experience.
All right. Well, if you're out there and you have questions for Dr. Wade concerning dentistry, the number here is 713-526-1230, 713-526-1230. And there is a caller on the line, and we will go to the phone. Hello, you're on with Dr. Karan Wade.
Hello. Good morning.
Good morning.
Did you have a question for
am I
me?
on the air?
Yes,
Am I on the
ma'am.
air?
You sure are. Did you have a question for me?
I couldn't quite understand if I was or not.
Okay.
I used to have a beautiful set of teeth. I mean, a lot of people thought they were false, But
Yes.
there's no way false teeth can be that pretty.
Okay.
But at any rate, I need a new set. I've eaten a lot of hard foods, a lot of acid foods, and things of that nature.
Right.
But I'm afraid just to lay up in that chair,
Okay.
and get all this stuff pulled out and get something new.
Okay, so what I would recommend that your first step is that you need to come into my office and get a consultation. And a consultation does not hurt. You come in, we do an examination, we'll do some x-rays, and we'll tell you exactly what you need to have done. And then we can explain to you each procedure to hopefully alleviate some of your fears. That's the biggest problem that a lot of people have, is that they're afraid to go to the dentist. And what's happening is that they allow their teeth to continue to break down, and it only makes things worse. And so then when you want to go into the dentist, you happen to have something major and something very costly. Whereas if you had gone earlier on, the problem could have probably been resolved with something at a lesser amount and wouldn't have caused you so much trauma. So I say all of that to say this. You need to make an appointment, come in to see me, and we do free consultations. The address is 2101 Crawford. We're right on the corner of Crawford and Webster, Crawford and Gray.
Okay, just a minute, Crawford
and Webster.
Gray.
Yes, ma'am. Crawford and Webster,
Okay.
Crawford and Gray, right across the street from St. John's Church, about 2 or 3 blocks down from St. Joseph's Hospital. And we're right there on the first floor. And the office phone number is 713
713
654
654
7756.
7756. You hear all these horror stories.
Yes, ma'am.
And it scares you, and
Yes, ma'am.
It scares you. So I'll try to make a visit down there. But how close can you get my teeth the false teeth to resemble my teeth?
Well, nothing is as absolute 100%. Okay, I'm just going to say that before I say anything else. If you have pictures of what your teeth look like prior to you having any problems, we can send those pictures to the lab, and the lab can fabricate your false teeth to resemble them as closely as possible. But I can't guarantee you that your false teeth are going to look 100% like your natural teeth used to look. But we'll try to get them as close as possible. Okay.
Well, I'm going to consider you.
Yes, ma'am.
Thank you so much.
Okay,
you.
you're very welcome.
Have a great day. Okay, we have another call for you. Hello, you're on with Dr. Karan Wade.
Good morning.
Good morning.
Yes, I have to agree with Mike. I've had some horrible experiences with dentists.
Right.
They rank up there with used car dealers and lawyers. But because they put me under, and then when I woke up, my perfectly good teeth had fillings in them. Okay.
Yes, ma'am.
And one led to a horrible infection for root canal. But anyway, I found out he had filed bankruptcy, so that's why he was just messing up everybody's good teeth to get more money from them. But anyway, on removing the metal,
the silver fillings, the amalgam fillings.
Is that pretty reasonable? Because I'm in the process of having the silver removed from my teeth.
Well,
and,
the fee on to have the silver filling removed is actually about the same price that it would be if you were having a filling, if you had a cavity in the tooth. It's not any more expensive because we just remove the silver filling and just replace it with the regular white filling.
Okay. And are you open on weekends, or do you have special appointments?
Yes, we are open on weekends. We're open the first and the second Saturday. The first Saturday, we basically do ortho patients. On the second Saturday, we do everything, and we're there from 7:30 until 4.
Okay, all right. Well, thank you very much.
You're very welcome. Thank you.
Thank you. All right. On weekends, 7:30 until 4.
Yes.
My.
Well, we try to accommodate our patients. I mean, I live in the real world, and I know a lot of people work Monday through Friday, and it's very difficult for them to get off from work or get their children out of school and go to doctor's appointments. So we try to accommodate our patients. So that's why we're there on 2 Saturdays a month.
Okay. Caller, you're on with Dr. Karan Wade.
Good morning.
Good morning.
I have a two-part question. Oftentimes, when you are just shopping around looking for dentists, it's hard. They will not provide you with a cost list for each procedure based on their findings or whatever their initial findings from or if you will, the treatment plan.
Okay.
So that you're able to compare are able to determine before you
get anywhere
incur the cost,
right?
How much your insurance is going to pay for, what percentage your insurance is going to pay for, and how much you're going to be out of pocket for.
Okay. Well, I'm not sure why other dentists don't do that. I thought that it was standard practice, but I can tell you what goes on in my office.
Well, what they do is they get you in, and then after they get you in, and then they'll say, well, you incurred this charge, this, and I'm like, wait a minute. So I recently went to a dentist, and that's what happened, and I just told her I just didn't like the way that went down. So what I end up doing is going over to UT, to the dental school.
Yes.
And I have found the only drawback with going to the dental school, they don't do any type of insurance.
No, they don't. It's because the students are learning.
You are responsible for that yourself, and it's frustrating, if you will, even trying to get the insurance after you come up with your treatment plan to get them to give you a cost analysis of how much each procedure that is recommended for you to get.
Well, if Dr. Wade will do that for you, would you give her a call?
Oh, yeah.
Okay, sure. Well, you can give me a call. The office number is 713-654-7756. And you can...
And it's Wade?
It's Wade, W-A-D-E, yes.
Did you go to Meharry by any chance?
No, sir. I went to the University of Texas.
713.
Okay, you went to UT. Okay.
Yes, sir.
Okay.
713-654.
7756.
7756.
Your first name, please.
It's
Doctor.
Karan. My first name is Karan.
Wade?
Yes, sir.
Spell it
It's
for him.
It's K-A-hyphen-R-O-N. Dr. Karan Wade.
Okay, thank you.
You're very welcome.
And the address again?
The address is 2101 Crawford. We're right on the corner of Crawford and Webster, Crawford and Gray.
And the telephone number is 713
654-7756.
And the telephone number here is 713 what I'm having one of those 526-1230.
I don't know the phone number here, Mike, but if you give me a card, I'll give that number.
713-526-1230. That is a shame. 1 minute, I'm thinking.
You were having a senior moment.
Yes, I'm getting more senior every moment. 713-526-1230 is the number here. And if you have a question about dentistry, then you need to call and talk to Dr. Wade, Dr. Karan Wade. And she is conveniently located in downtown Houston. And every other Saturday.
Every other Saturday, we're there at the office. And I just wanted to give this information out to the gentleman that had just called in. We do free consults. So you can call the office. You can come in for a free consult. We'll give you a treatment plan, and we'll tell you exactly what each procedure costs before you incur any cost. So, like I said, we do free consults. So that's for the gentleman that called and anyone else who calls the office. We'll do a free consult for you, and we'll let you know what your out-of-pocket expenses will be prior to you getting anything done.
All right. Now, I had a conversation with a person who is up in age. Well, I won't say, not old, mind you, but
up in age,
above 50. And all their lives, they have not liked the fact that some of their teeth are not straightened.
Okay.
And I said I would ask about the wisdom of someone in their above 50, above 55, trying to get braces, trying to straighten their teeth.
Well, there's no reason for them not to get their teeth straightened. If you have all your teeth and you don't have any periodontal disease and your teeth are just crooked, no matter whether you're a teenager, you're in your 20s, 30s, 40s, 50s, 60s, or beyond, because I have had a patient that was, I think he was like in his 70s, and he had all his teeth. His oral health was great, but his teeth were crooked, and he said he was never able to afford it because he had a lot of children, and he raised them all. He said now was his time. And I put braces on his teeth, and he was very happy, and the outcome came out very, very well. So age is not an inhibiting factor to anyone getting braces, no matter how old you are. If you have all your teeth and you have good periodontal health, meaning your gums are very healthy, you can get braces no matter how old you are.
Really?
Absolutely.
Okay.
Age is not a factor.
Age is not a factor.
No, sir.
Is cost a factor?
Cost effect may not be a factor. It's going to be the same price that you would pay if you were in your 20s or if you were in your teens. There are some insurances that do not cover braces for adults. Some insurances go up to 18. Some of them go up to 21. There are few insurance carriers that are out there that do pay for braces for adults, but most of them don't. We have a special going on for braces for regular traditional braces. It's $29.99.
Is that $2,999?
So that's a special that we have going on in the office, and that's a cash price only. Even if you have insurance, you can use that cash price. You can get that same cash price, but the thing is that you would have to file that part on your insurance, and we give you all the paperwork because that's a cash price only. Now, regular traditional braces run $5,200, but we're doing a special for my patients because I just think that everyone should be able to afford to get the kind of dental work that they need, that they want to have done. So we offer this special to our patients.
Whoa. I know everything has gone up in cost, and I never went to the dentist until I was in my 20s. So I was blessed, I guess, and I had to have some stuff done for my daughter, but I have no idea of what we paid. But
well, I'm sure your insurance company does.
Right.
Well, braces can run anywhere from about, I'll say about 20. The lowest price I have ever seen was like about $2,600, and they can range up into up to $10,000. It just depends on where you go and who's doing it. I mean, I've had patients that come to my office that have gone to dentists that are in a high rent district, and they were saying that they were going to cost them like $7,000 to $10,000 to get Invisalign braces, and I don't charge that much. I'm not in the high rent district, so.
Now,
And
Invisalign.
the Invisalign are the those clear braces. They're the clear aligners. They look like mouth guards, and they're just clear. And there's a series of trays that actually move your teeth, and you change the trays out every 2 weeks, and each tray will move your teeth so many millimeters. And they work perfectly. The key is that you have to wear them. You don't wear them, they don't work. But they work very, very well. I have tons of adult patients who want the Invisalign because you don't have to have all that wire in your mouth and all those metal brackets on your teeth.
Now, if your teeth are only crooked on the top or on the bottom, do you have to?
Treat both
Yep.
top and bottom? Well, I do. The thing is that I treat top and bottom. Even if your teeth were perfect at the bottom and they were crooked at the top, we still would have to stabilize the teeth at the bottom. At least I do, because your teeth contact, they like to touch side to side and up and down. If you start moving your top teeth, your bottom teeth are going to lose their contact, and then they're going to start moving around because they're going to try to find their contact. So you still would bracket up the bottom teeth even if they were perfect, just to keep them stable.
Okay. Well, we will tell our friend that at least
You tell your friend to come on down.
$29.99, and that's the cash price.
That's the cash price for regular traditional braces, the wires and the brackets.
Okay.
Yeah, the old-fashioned kind.
Okay. Is that credit card cash or is that cash?
No, credit card, cash, check.
Okay.
We even have a finance a company that does a third-party finance company called Care Credit, and what they do is they will pay us, and then you make small monthly payments to them.
Okay. So it is possible.
It is possible, and then I think they have, if I'm not mistaken, up to 18 months is no interest if you make your payments on time.
All right. Caller, you're on with Dr. Karan Wade.
Hi, I'm one of Dr. Karan Wade's patients. My name is James.
Hi, James.
I want to highly recommend Dr. Karan Wade. She's done an excellent job in working with her for 3 years. She's been very, very good to me and correcting a lot of my problems. She is affordable. They do work with you. And I'm a big baby. And I must say that she takes care of me because, I'm a scaredy cat when it comes to the dentist, and she's the most comfortable I've ever been with any dentist in my life. And I've had to have a lot of work on my mouth due to a problem I was born with, plus I've been negligent on my part. But I will say to that last caller, Dr. Karan Wade is an excellent, very professional, but at the same time a very caretaking person for you as a dentist. I will say that she does an excellent job, and I've been very pleased with her. So I highly recommend her to anyone that has a problem with any other dentist or not sure about anything. Please give her a call. Please set up her workers are very, very good. They take care of you, and I just say that she's very good at what she does.
Thank you so much for that plug.
Well, no, it's true, though. I really highly recommend her to everyone. I want to thank you so much, Dr. Karan Wade.
You're very welcome. Very welcome.
All right, thank you, Mr. Harris.
Well, thank you.
Have a wonderful day.
Okay, you too.
Bye-bye.
All right, bye-bye. Yeah, testimonies are excellent. Not plugs, testimonies. Plug is when somebody calls.
Well, I'll take that testimony. I try to treat all my patients as if they were, if I were in their chair. I think that a lot of that stems over in my former life. I was a registered nurse, and I worked with pediatric patients. So I try to be very conscious of what's going on with my patients and have them, just showing them very good chairside manner, so to speak.
Okay, well, you have another phone call. Hello, caller. You're on with Dr. Karan Wade.
Good morning.
Good morning.
A real quick question. I hope this isn't a silly question. In your office, are you the primary dentist? I mean, will you make the first consultation, and then do you do all the work? I guess basically is what I'm asking.
Okay, I do 99% of my work. If you have some wisdom teeth that need to be extracted and they're completely impacted, I have a doctor that comes in to do that. But any other work that needs to be done, I do all the work.
That's what I need to know. I appreciate it.
Okay, thank you.
Okay, impacted. What does that mean?
Meaning that the wisdom teeth are down into the bone. They haven't come out up in your mouth and they're causing you problems. They're still up under the bone, and so they need to be removed. So you have to remove all that bone around the tooth in order to take it out.
Okay, let's take another call here. Hello, caller. You're on with Dr. Wade.
Hi, how are you?
Good morning. How are you doing?
Good morning. This is Miss Green. How are you?
Hello, Miss Green. How are you doing?
I'm good. I was just wanting to piggyback on James, who called. I'm a patient of Dr. Wade's, and truly, truly phenomenal dentist. I was afraid to go to the dentist. I was very negligent about going to the dentist. But one day when I sat down and talked with Dr. Wade, I have been back ever since. She's very, very knowledgeable, makes you very comfortable. The staff is excellent. It's really like going to see family. So I do want to recommend to anybody listening, if you're afraid, if you've had bad dentists, I've had that too, trust me, once you go to her, you won't go to anyone else. So, and she's put up with me. I'm a tough cookie. I'm a tough cookie, but she's made it very comfortable. So she's wonderful. And I hated to smile before. Now I can't stop smiling because my smile is truly flawless now.
You have the Hollywood smile now.
Yes, I do. I have a Hollywood smile. I think I'm famous now. So please, anyone, if you are looking for a dentist, if you're worried about going to the dentist, trust me, you have not seen anybody like Dr. Wade, so please go and see her.
Thank you, Miss Green. I'll see you on your next appointment.
Yes, I'll be back. You all have a good one.
Okay, bye-bye.
You too. All right, and we're going to take time for one more call, Dr. Wade. Hello, you're on with Dr. Karan Wade. This is KCOH Houston, the program In the Mix. I'm Michael Harris. Hello?
Good afternoon, Dr. Wade. Let me ask this quick question.
Yes, sir.
In coming to your office, how efficient is your office? Because I've been to dentist office where I have to sit out in the lobby, 45 minutes to an hour, and then get back there and sit another hour. So how efficient is your office?
Well, I put it like this. I try to be very efficient. And sometimes when you're working with patients, sometimes you do run over. And if we are running over, my staff will come out and say, hey, Dr. Wade is running over. Would you like to continue to wait, or would you like to reschedule? So we would, I can't guarantee that you won't wait a little bit, but most of the time we get our patients right in within 10 to 15 minutes of them signing in. We usually get you in the chair. Most of the time it's quicker than that. So we try to be conscious of your time because your time is very valuable. We understand that, but just be realistic that sometimes the doctor does run over, especially if she has an emergency that came in prior to you arriving.
Okay.
Okay?
Thank you.
All right, thank you.
Okay, thank you. And Dr. Wade, it is time to wrap it up.
It's time to say goodbye, Mike. My heart is broke.
Well, what you're doing is you're changing the world one smile at a time.
That's our slogan, changing the world one smile at a time.
And how many T-shirts do you
I don't know, I got about 100 of them. I have to market every place I go, so I wear all my T-shirts all the time.
Well, they look very nice.
Well, thank you. So I'm going to give out the phone number one more time, 713-654-7756, 713-654-7756. The address is 2101 Crawford, 2101 Crawford on the corner of Crawford and Webster, Crawford and Gray. And you have a great week, Mom.
All right, you too now.